The use of anti-anxiety medication is on the rise during COVID-19, and approximately 92 million benzodiazepine prescriptions were fulfilled from the U.S. outpatient pharmacies in 2019. A recent headline caught our attention. Reports are that the FDA is now requiring stronger label warnings about the risk of addiction and abuse of benzodiazepines. Now, here to talk about that is board-certified psychiatrist Dr. Sue Varma. Hey, Dr. Varma, thanks for joining us today.
Hi, thank you so much for having me.
You're seeing, you say, a rise in these prescriptions during COVID?
Absolutely. Actually, we're seeing a rise anywhere from 10 to 34%. And it's understandable given the fact that 70% of people, according to one major survey, are experiencing increased stress. And that has to do with a variety of factors like job loss, people getting sick, and this social isolation that's gone on much longer. And the way that I see it is that benzodiazepines are extremely effective. They're effective in the short term, time limited on low doses. The problem is that when a coping mechanism, such as this medication, is potentially exacerbating the problem, as we see that in long-term use of benzodiazepines, people, when they try to get off of it, can have tolerance, withdrawal, they have psychological dependence. The problem to me is the fact that a lot of times patients get these medications, in fact, the vast majority of times, from non-psychiatrists. So while our primary care doctors are frontline, and I have all the respect for them because they're dealing with a lot of these mental health issues, the problem is that patients are bringing up these issues. Let's say they go in for a 10-minute visit for their doctor for diabetes and cholesterol problems, and they end up engaging in what we call these doorknob conversations, in the sense that the doctor is on their way out and their hand on the doorknob, and the patient is like, oh, by the way, doctor, I haven't slept in 6 months, or I'm feeling so depressed. And the doctor ends up writing a very quick prescription without really taking, let's say, a full history. And so I would say that it's extremely important, if you are feeling increased stress, that you have to book a visit specifically for your mental health and bring up these issues in the beginning so that your doctor can do a thorough, what we call differential diagnosis, to rule out and to really fully understand what is the diagnosis. You know, 80% of medications that are written for mental health are not written by psychiatrists. So we want to make sure that the patient is adequately presenting all their symptoms and that the doctor can get a full picture. You know, a lot of times insomnia, anxiety could be a result of any number of things, from sleep apnea to thyroid problems. It isn't necessarily depression or anxiety. And again, the doctors are well-intentioned and the patients are well-intentioned, and it's understandable, but we have to make sure that the medication fits the diagnosis.